Welcome back. You're listening to the Ancient Health Podcast. I am joined by my co-host, Dr. Chris Motley. And today we have an awesome guest that I'm thrilled to talk to today. This is a story that's near and dear to my heart about breast implant illness, but we've got an expert with us that has really, I think, expanded the conversation of breast implant illness. And he's doing that by educating women on how to prepare themselves pre-operatively and post-operatively. So I get this question all the time for women that say, I'm so sick from my breast implants, and they get them out and they still have so much illness. They still have so much inflammation in their body. And so Dr. Rob is here with us. Dr. Robert Whitfield, he's based in Austin, Texas, but he is educating women through his platform. He's got all kinds of educational resources we're going to talk about, but I'm so thrilled to have him on here because he understands what women are experiencing as far as their symptomatology. And we can talk about what that looks like, but he's a board certified plastic surgeon, so many different credentials, still operates on women every single week. So he is deep in the weeds clinically with everybody. So if you're listening to this, you likely know somebody that is affected by breast implant illness. I mean, it's so prevalent right now, but there are women that are living in chronic disease and they don't understand what's driving it. And so we're going to talk about what some of those action steps could be if you're looking potentially to explant and what the healing road could look like after you do that. So Dr. Rob, thanks for joining us on the show. Dr. Motley, glad you're here too.
Thank you for having me on.
This is a good, I guess when we say like leeway, I've had some patients in the office in the last few weeks that basically have had breast implant illness. And some people don't even know what breast implant illness is. Many of you people out there have had individuals that have gotten chronically sick without any explanation. I had a close friend of mine. His girlfriend kept having that illness or had something going on where they had every test that they could check, and she was having some different avenues with mold, and she had some different infections. And for the longest time, he was working on her, and he basically helped her out, like cleanse, and detox, but she still would not get over that hump. And finally, they found out, Doc, that she'd had some issues, like they could see mold like growing in within the breast implants, and that she had breast implant illness. Could you just describe to people out there what this is, or what this situation is in health, and how much it can affect the body?
Sure. So I look at breast implant illness as a chronic inflammatory disorder. So the device is part of it, certainly, but it takes a number of things to happen. We've looked at genetics over a long period of time, and there's a very specific number of genetic problems. So SNPs or mutations in your genetic code will limit your ability to just detox in general. So once you have that as part of the problem, then no one can pick their parents and no one can outrun a bad diet. So once you have that and too much toxic burden, either from your environment, your food, in this case, a device, potentially, then it just becomes like a cascade. The gut microbiome will go off. You may develop more and more food sensitivities. Hormonal balance will go off. You may have Hashimoto's. You may have suppression of your sex hormones. And then you can hear, like, this becomes a very common thread in my patients. And they don't know what's going on. They go visit all the routine, doctors and specialists, and some of them get put on steroids or methotrexates or antidepressants because no one knows what's wrong, and they feel like, well, this anxiety is due to the intrinsic problems, and they'll put them on an antidepressant, which is not the right thing, honestly. And when we first started doing this, I would explant people, and about a third of them would get better, which falls in line with what I know now. So I have over 1,100 consecutive cases with PCR testing just of the scar capsule around the implant, not the surface of the implant, but the patient's scar tissue. And it reveals that Cutibacterium acnes is the most prevalent microorganism, which is a bacteria that's found in our face, neck, chest skin, shoulder skin in high concentrations. It's been implicated in shoulder replacement biofilm contamination. It readily produces a biofilm, which is, for everybody listening, a biofilm is just a group of microorganisms. In this case, we're talking about bacteria. They collectively adhere to the device, and then they can produce basically like a coating that makes it very, very difficult for your body to handle. And people ask me, well, how do you get this and how do you get that? And so the three ways that you can get a biofilm in the operating room, two of which are somebody hands the surgeon a contaminated device. The surgeon then contaminates it potentially on placement. But the third and the most common way is just through life in general. You get a skin infection, a lung infection, sinus infection. This bacteria typically can seed your bloodstream, and that's how it attaches to something because you become bacteremic. And it's not new. I mean, this has been around as long as any kind of implant has been around, including heart valves. So it's not hard to figure out how someone gets it. The problem is because no one shows up with a red swollen breast, it's very hard for everybody to figure out, what's going on. It doesn't make a lot of sense. And when you take a symptom inventory of these patients, they check all the boxes in every system, which is very confusing to anybody. But, if you roll it back and listen to what I said about genetics, toxicity, it will help fill in the blanks. It will make sense. And then the thing about, not everybody's going to get better, which is, it used to baffle me. And I would send people to functional doctors, nutritionists, anybody who would, offer to help the patients. And then because of the pandemic, we just had to bring everything in-house. So we run our own functional program now.
Oh,
and
that's awesome.
Care of everybody. So we have detox practitioners. So we run detox programs with Cellcore, pre and post. And then we have my program running, Sharp, which just our supplementation is based on genetics. So I pause everybody else's supplements because everybody's trying to get the things that they know from their practice that will help the patients. The problem is they may see a few of these patients, like you mentioned, a week or a month. I see like 30 or 40 a week. So they're all similar in terms of not just like the story, but the makeup of many of the situations.
Do you have, you said it's called Sharp supplements? Is that what the name of and it's based on the genetics? That's awesome.
So Sharp is our platform. It's Strategic Holistic Accelerated Recovery Program. And the book I wrote is coming out about that as soon as we get through the editing process. That's quite the chore. Our solutions are our supplements for it, are Dr. Rob solutions. And those are just curated based on genetic reports.
Okay.
And I switched. So most people have a lot of trouble taking supplements. In this group in particular, they have a lot of absorption issues and leaky gut problems. So we learned early on and transitioned away from capsules to mostly liquids to make it simpler. So the majority of our formulations are just liposomal.
Wow. This is great. I mean, and when you have those that are particularly like set for those genetic types, are we finding like, I hope I don't get off skewed too much, but when you talk about like any type of condition with biofilm, if they're able to like, reset and cleanse it out because of their genetic makeup, are you finding like particular SNPs or genetics? And with that, I'm saying when you create your supplementation, are you finding like you can have a good set formula for these individuals that have these issues with breast implant illness and it's going right after that detox pathway? Is that what you're indicating with your supplementation?
Right. Yeah. So the vitamin D pathway, that's almost uniformly off in these patients. So they don't activate or don't transport or don't absorb well. And methylation, I think everybody's obviously familiar with methylation at this point through obviously your show, my show, and everybody talks about it. So about, if you want to be conservative, 40 to 44% of the people don't methylate well. So that's, I assume that most of the time. So ours are just methylated, Bs. And then glutathione's a little bit different. I have a lot of people in Texas who have problems with mold and chemical exposures based on where they live. And if you give them big 100 milligram doses of liposomal glutathione, they'll just be like, this tastes terrible. So you just kind of slowly start them on, I just use a few drops and work up a tolerance, because that's what they need. They're detoxing basically as soon as they get a hold of it.
Oh yeah.
You have to be careful with things that ramp up mitochondria because people get headache really easily. So we just keep all the antioxidants super simple in the beginning until they have more tolerance.
That's good.
Yeah, that's great. I feel like I need to ask this because I just got to speak for the ladies here. And I know this because I had implants, guys. Y'all know this about me. There are women that are going to want to know, because I get this question. Can you supplement your way around having implants? In other words, can you take enough anti-inflammatory support? Can you support detoxification pathways? Can you support methylation? Can you support, your genes, if you even know it, to get around? Because I'm telling you, women, until they know that it is 1000% the implant driving the symptoms that they're experiencing, they're gonna throw everything in the kitchen sink at their body to see if they can heal and keep the implants. Have you ever seen that happen? Like, is it even possible?
Yeah. So obviously I get asked this a fair amount, and then can I, ferret out who's going to have a problem, from a device? Short answer is, you're going to plateau at some point, regardless of the regimen, because the device is in place. So not to be, too brutal about it, but I haven't seen that work. And most of it has to do with your genetics. So I get a super select patient now. So if they're coming to see me, they've already arrived at that conclusion. I'm not giving them that conclusion. If they haven't gotten there yet, then they're going to try everything under the sun. And that may, be taking a bunch of binders and doing a bunch of IR sauna or barrel sauna or cold plunge or whatever. I will tell you, I'm not an advocate for extreme heat while you have a device in place. They were never studied with extreme heat. And I have a great patient of mine who had a barrel sauna who was basically leaching the chemicals out of the implant into their system. And so when I took them out and repeated their tox test and compared it to the pre and, to the post, you can see this go away. And people are, they've been critical of me for talking about this, and which is fine. And to your point, like, people will try to make themselves well through detox. And that's a slippery slope depending on what you're doing. You can make yourself have a Herxenheimer reaction if you just keep doing aggressive things, whether it's with binders or sauna or something, because the more aggressive you get, it sometimes will just be to your detriment.
Yeah, I know nothing about that. Dr. Motley is definitely going to laugh at me for that because I'm so aggressive with every protocol. So anyway.
Yeah, basically, Doc, I'm serious. If you tell Court, like, okay, I want you to take one of these, she's going to automatically multiply it by God's perfect number 7. And she's going to go right at it. So usually whenever she says she has a headache, I'm like, well, how many did you take? And she's like, I took about 12 today. And I'm like, good heavens. I'm with you about heavy detox, but did you do that, Court, too? When you had your breast implants, did you try to go heavily, like with the amount of supplementation to get it out?
Well, I probably went a little excessive, but it's funny, even I explanted in 2019 and I still have fungal issues around my incisions and like where he did the, like, it's so wild. And I've done like just on the skin, like it's just, you can just see it. Anyway, we're talking about like super personal stuff, but I can't even tell you how many protocols. I mean, Dr. Motley can testify to this, but I mean, the amount of herbs and stuff, I had severe gut inflammation and infection. Like, my GI map looked like a Christmas tree. It was so lit up. So, I mean, I'm probably still working things out But anyway, that's a total tangent.
Oh,
we could get Dr. Rob's maybe his input on this, because I know this is very specific to me, but for women that maybe have explanted and they didn't do anything about it, and they maybe still have, a thyroid condition, or they still have some stuff. I mean, is it possible that years, months or years later, if you're not addressing something, because some women are just now learning some of this stuff and they're like, I still have, I feel a little bit better. Maybe I'm less inflamed, less puffy, but I still have some autoimmune activity. I've still got some things going on that would indicate that there are underlying issues, maybe some immune dysregulation. So what would you say to that, Dr. Rob? Is it too late? Should they do some of this testing if they never did it before?
Yeah, the program, the SHARP platform, was created for that issue, because I would have a group of patients who got better in like 90 days, and then I'd have 2/3 or so get better at 6, 9 months, 12 months, whatever, and then I'd have this group that never got better, meaning like they would just linger and linger and linger and linger. And now if you just think about that group, they're the people that genetically have the least ability to detoxify. So if you don't identify that and then clarify it with metrics to follow, we use a Vibrant Wellness Total Tox test, just because I have so many people with so many things in different areas all over this country, and now I have people come from Europe, that you have to do your best to, to your point, build out the picture so they understand it. Otherwise, they'll develop a lot of aggravation. They'll have gone through this, and it's not easy. And I'm sure you can attest to this. So you have surgery and recover, and then still not feel quite right. And then there's a lot of that negative energy that comes towards us at my place. So some of it is making sure that we know as much preemptively, so that we know what has to work in terms of their detox plan, which runs parallel to their surgical follow-up, which is running the same time as their supplementation. I think people can't get confused about the two things. Detox with Cellcore is not supplementation with my line. So those are to supplement your immune system pathways to help you take care of what should be done day to day. If you don't have the nutrients in the pathway from your diet, and or you're genetically incapable, then you have to supplement it. And then if you have a bad tox profile, you're going to have to detox that. And that's an independent but parallel pathway.
That's a good point, Doc. Okay. So if you have that, Doc, okay, so let's say an individual, whether they still have their breast implants in, whether they just got them out, you say that there's differences. So a person who gets them removed, you're saying is that some individuals think, well, I'm going to feel tons better, and they may not, because you're saying like genetically, they may not have the capability, the capacity to detox what they've had in their body for so long. Do you find, this is one area of my brain I've always wanted to know, like all the stuff that's inside the breast implant. Some individuals say, what would make it so toxic? Or what are the major heavy hitters? And how long can that stuff stay in the body if it does leak out or leach out into the body, or how the toxic effect? Because sometimes, I have individuals that have breast implants and they're like, well, how long will it take me to detoxify? I'm like, I'm not the expert on that. I mean, is there a half-life to the metals, or how long you see a basic effect on the body from the toxicities?
Yeah, so that's a complicated question, because if you
sorry about that. I didn't mean to throw so much at you, Doc, but yeah.
Take the generations of implants. The early ones had a filler that was more like silicon syrup, and then now it's more like gelatin. Not to, just try to make it simple. So those, if they rupture these days with the newest generations, they shouldn't go anywhere. So you don't have it wandering outside the capsule, so to speak. So the best situation is if there's a rupture, it stays within the capsule. It's identified, and I always recommended for all of my oncology and cosmetic patients to have that removed, because nobody wants a ruptured leaking device. It's not on the package insert. It doesn't say leave in place if defective. So Now the question about toxicity is different. So that's the reason I check a tox test. So I'm not approaching it. I try to just build as much clarity around it as possible. So on tox tests, I don't see as many heavy metals because that's what's in the shells as you would typically think of. I see things like more environmental problems, like MEPs and BPAs and phthalates and glyphosates. And I don't see a lot of metals, barring the one I told you who was heating themselves up in a barrel sauna. Now, that person had every single metal in a device shell basically on their tox report. And after I took them out and repeated that, they were all gone.
Oh, wow. Wow. Fantastic. Is there like on your subline, because they would ask, patients would ask, like, is there one major, I know everybody's different genetically, doc, I'm saying, but is there one detoxifier or one binder that you would say that works on most people like that to help with all that toxicity after somebody gets their explant surgery?
Yeah, we've partnered with Cellcore to start gentle binders initially because some people just do not do well. They have such gut problems that, and, you know, I would say, you know, that is the most difficult thing to overcome are the gut issues. So they're so complex, and then I'll get somebody who was put on Accutane as a child, or they got rounds and rounds of antibiotics for whatever reason. And, you know, their brush border's not intact. They have leaky gut, and it's just like a total shit show to take care of them because what you're trying to do is increase their protein content, especially after surgery. I try to get it beforehand. So I try to drop, you know, not a total caloric amount. I don't pick calories. I want grams of protein because that's what your body really needs to recover. But man, the absorption of that is challenging for these patients. They have so many gut problems. So we start trying to work on that right away.
Yeah, those gut problems, I'll tell you. And there's so many things that feed into gut problems outside of just your implants. I think your implants can perpetuate a problem that's already there. So do you see women that have, like, they've already got an underlying condition? Maybe they've had exposures to mold. Maybe they've got, you know, a heavy toxic burden. Their liver's already congested. Obviously, the genetics and detox pathways, all of that plays a role too. But it's like their bucket is filled, and then they get the implants, and they're like, oh my gosh, this just pushed me over the edge. And now I'm like, I've got all these different other symptoms that flare up. So for those people, like, how do you teach women? Because this is something that I am so passionate about, is like, it's almost overwhelming to think about all the possibilities and variables that you don't know about your body. So as far as maybe like testing or just practical steps, are there any specific nutrients? You've already hit on protein, and diet's obviously really important, but say someone's just starting their journey, they're wanting to support themselves, you know, maybe even identify, if they do have implants, how they can set themselves up for healing until they get the explant surgery. So a lot of times you have to wait months and months and months before that can even happen. So like, what is it like? Break it down, maybe just deconstruct a few pieces for us, because I know that it's a lot. And it's like, well, what if I have the rare genetic, whatever, and then I've got this factor and that factor, and I don't even know how to find these things. Where's a good place to start? And what would that roadmap look like for somebody that maybe is very sick, very symptomatic, you know, maybe expects that their implants are playing a role, that they could kind of get them on that route to healing?
Yeah, I mean, there's two things. The curiosity that we've always had about genetics and in my practice has led, you know, where we've gone. So now we use Envision Labs, which is a new vendor to us, and they look at all the same genetics that we were looking at previously, but we've added something specific because everybody's worried about going and having surgery and having anesthesia and waking up properly and not feeling groggy. And we really worked hard. So we use this Envision Lab testing to look at the drugs that they'll receive through us before surgery and during surgery, so we can understand better how they'll metabolize. And we do everything we can to limit narcotic usage. I have a very specific protocol that we run. But if you're trying to just get started, and basically what we're talking about is inflammation, and your ability to cope with it is based on like the air you breathe, the fluid you drink, the food you eat, and your genetics. So the easiest thing is to do a saliva test with Envision Labs, and that will clarify and codify some of the things we're talking about in terms of your ability to detoxify. And then our inflammation support bundle is based on the genetic reports of hundreds of breast implant illness patients. So that's built out specifically to increase compliance. So there's not a lot of capsules. It's basically liquid to support those immunity pathways that involve vitamin D synthesis, your B vitamins, glutathione, and your antioxidants, ACE. So those are all set up fundamentally from the jump. So you can take and start those. And that's the hack, whether it's for breast implant illness or aging, longevity, whatever you're looking at. You're just trying to lower inflammation. We know it works. Because I have, just to your point, sometimes I have 8-month waiting list. So people will get put on that and they'll lower their inflammation and start feeling better.
Wow, good.
The caveat is that's going to plateau at some point because, now you're getting the right nutrients, but your gut health, your exposures, cleaning up your air, water, and diet will always help you, because part of what's making you ill is your food intake.
Yes.
So once you resolve that, it's a lot better.
That's a good point, Doc. I mean, because I know that you said Envision Labs, that they'll do a gene testing, right? And so I don't want to get, well, maybe the people out there would love to know. I mean, are there particular, what are the particular genes? I don't want to get too, in depth. I know it may not be where we want to go with the conversation, but I'm saying with the genes on a gene report, which genes usually do you see that are the most affected? Somebody could look on their gene test if they have one, because there's a lot of people that come in, they have their gene report. Is there specific ones that allows? I know there's toxicity removing genes, but are there any ones that particularly you look at when you look on a gene report to see if they're going to remove the toxins?
Yeah, we'll hit the main ones here and give everybody a couple things to think about. So, when you're talking about glutathione, the main genes you're looking at are GSTT1, GSTM1, and GSTP1.
Oh, okay. Yeah.
And then there's a lot of them that are involved with methylation and how your antioxidant pathways work. So MTHFR, which everybody's probably heard of, MTR, MTRR, FUT2, SOD2, and GPX. GPX is part of actually vitamin D and VDR as well. So those are probably the simplest ones that you will get on a regular report. The detail of the report may not be short of just what the mutation is. Some of ours are looking at specifics. How many copies of the gene do you have? So some people, they have no copies of a gene, so it makes it, that pathway is not going to work properly. It doesn't matter, if you don't have the copies. So it can be, and it's kind of I think at this point we should all just understand that, you get this material and that's your playbook, and you can't be upset about it. That's just the way it is, but you can work around it, because there are ways to, from a nutrient standpoint, help you resolve some of this. You just have to know it in order to solve for it. And the whole program is set up to be, on the front end, doing whatever it is possible to help support those pathways, get your diet and fluid and air quality improved so that you'll feel better and recover faster.
That's a good point, Doc. Good point.
Yeah, I think the genetic piece is so interesting. And if you're listening, genes, like we talk, on a more like, kindergarten level, like genes are the hardware that you have, but it's all the inputs of your life that it's basically instructions to turn genes on, to turn genes off, to make different reactions happen in the body. So that's why we're always talking about nutrition and exposures and things like that, because it's all information to your body, to your genetic code, whether or not it's supposed to do something. And it creates this interference and chaos in your body. And then all of a sudden you start to see the symptoms show up. So we think like, okay, we have to tailor everything to our genes. Well, you kind of do, but it's not as hardwired. Like there's a lot of adaptability. I like how you use that. It's how your body's adapting to the stress. So if your body's overwhelmed and you've got all kinds of like kinks in the hose everywhere, then you are going to start to experience symptoms, but you have a threshold of margin that gives you kind of grace in that space. Like you're not going to just shut down if you don't get your diet right. Like your body has an ability to kind of work with some different variables. So I think that's important to realize, because as you heal, you have to give yourself, one, you've got to give yourself time, but two, you've got to be able to give yourself enough grace to realize that you're not going to get it all right. You don't have to have all the information. I've realized that over years and years. Like you're never going to have all of the information to know confidently, this is exactly what my body needs. You just need to be able to confidently point out the inputs that you know are not going to give you a positive outcome. And having extra toxins in your home and, blue light and just poor lifestyle habits, like that goes a really long way. So don't neglect the foundations of your health. Like stay in the lane of constantly coming back to the foundations. And then you can do some of the testing to really dial in some of the specifics, because that can really help you kind of carve away, like really start to trim out the stuff that's causing that excess inflammation. But again, like I think it was an important mention earlier that there's really no way you can dig yourself out of the hole of having implants. Like you will plateau. I can tell you that for, I was on a wait list for, the better part of a year almost before I could go in. And so I was doing everything I possibly could and I was okay. But I got a little bit better. But again, like I just knew, I was like, the implants have to go. Like that is a massive threat to my immune system. And so I'm only going to get so much better before I'm able to fully get to the end of healing. And still, that's kind of a journey, an ongoing journey, like I said. But maybe we can even, for somebody that has dealt with, and honestly, whether it's breast implants or it's something else, like we have people with they've had all kinds of dental work. They've had other implants. They've had other things in their body that has created a suppressed immune system. What are the things that are most important outside of nutrition from, the perspective of a doctor? Like, what are some of the things that nobody else is talking about that, you're like, hey, this is like, seems to be a commonality for people not being able to get better. Are there some of those outliers?
You're teeing it up for me. Number one thing that I can't solve for is a poor mindset.
That's good. Yeah.
So
that's it.
Pain has three factors: the biology, the psychology, and the social stressors associated with pain. So if I get somebody having pain 3 months out from surgery, of course they're not going to be happy, and of course they're going to blame me. Somehow it's going to be that I didn't do something correctly, and they get all this frustration and anger, rightfully so. But we partnered with Amanda Savage Brown, who's a psychologist out of Chicago, and she wrote the book Busting Free. She had an explant, and she talks about everybody has a breast playbook. That's very interesting to interview her and listen to her perspective about it, and why someone gets implants and the issues and everything. And so when we do an explant, whether it's for a patient who had them for cancer or cosmetic, it's a very profound change. And the folks who have a lot of support and really treat themselves well, and if you will, really love themselves, do better.
Yeah.
The ones who don't have support or constantly are being negative to themselves have a difficult time. So, the hardest thing ever is to change a behavior. And whether it's somebody like Dr. Joe Dispenza talking about changing it, or whether it's you learning from Amanda Savage Brown about how to change it by reading her book, or you do Qigong, or you meditate, you have to get your mindset, because Dr. Rob doesn't change mindsets. That's not my job. So I'm hiring a psychologist who's a professional in mental health to help with that, because I'm a plastic surgeon and I've done about almost 4,700 consults for breast implant illness and over 2,000 explants. I know how to do the cases, but I can't change your mindset.
Yes. It's, with that, Doc, I know it's a lot of stress. It can be a lot of stress on you and having to go through that. Do you find that with mindset, just like Courtney was talking about, if she had to wait for a year, can like the breast implant, like if they're in breast implant illness, change their neurology in their brain? Like, can it change their attitude? Can it make them, be more fatigued and more angry, or, not agreeable? Is that something that can happen? And because I was wondering about like, the telltale signs, like somebody saying, I think it's my breast implants, because many times people don't. Are there that psychology is maybe the first signs or signals? Or are there other signs and signals? So I hope that was a two-part question. A, can it affect their psychology? And B, maybe what are some of those telltale signs that some people should look out for? Like they may not even know. They're like, I feel pretty good with my breast implants, but what can they look for?
I mean, the simple thing is if you're having more anxiety, if the gut-brain axis is off and you're having more anxiety, there's lots of reasons, and this happens obviously in patients who don't have implants. So I think it will go back to your exposures and your diet. But once your gut goes off and you can't absorb the nutrients in a manner which helps you carry out just all the things you need to carry out cognitively, then it all goes sideways. And anxiety becomes a real prominent feature, and that has to do with a lot of things, like how you metabolize sugar and how you metabolize caffeine and what are you taking in, and garbage in, garbage out. So if you eat like trash, you're going to feel like trash. Mm-hmm. And if your gut doesn't work, no matter how well you're trying to eat, now you're fighting an uphill battle.
That's good.
Yeah.
So
when you find the uphill battle, though, like when you're going through it, when you start to see garbage in and garbage out, and I want Courtney's input on this as well, because we talked about it before. Like if you have that much like bad diet and such, what are some of the toxins that most people out there, like from an infection standpoint, are there things that whenever you have a bad diet, of course you're going to feed bad critters and such. Do you find, like, we're talking about that bacterial level that was really high? Is bacteria like the main thing that most people would find in their, blood work? Or is there any type of other infections that they could see? Maybe they have it in their body that could be a contributor to the breast implants.
Yeah, that's always a hard one, because this is another reason why it's difficult for people to understand what's going on, because it doesn't lend itself to a specific laboratory value that's out of control. Because you can have a lot of underlying inflammation, as you know, and not have a high SED rate or a high CRP. We were using a company who was a startup out of the pandemic, and they were looking at thromboxane A2 metabolism, and you could measure it in the urine, and it was good. It's super sensitive. So if you were taking anti-inflammatory medications or homeopathics or eating a lot of ginger or turmeric, you would affect the result. But if you weren't, say for instance, I got patient A and they are just learning about this, like we're discussing, and they haven't done anything. And I take that patient, I get that test to them, and we have a specific example I'll talk about. I had somebody who couldn't come because of work and taking care of their kids for several months. So they basically ran the program, and we watched them drop their inflammatory score on this test. And all we did, from the jump was, after you get the test and take the supplements and do the test, we want you to do the following: cut out gluten and cut out dairy, cut out all processed foods and sugar that doesn't come from a fruit.
And cut those out.
Yeah. And if you do that, fructose and sucrose are awful. I mean, they're terrible things to have in your diet, and they're in all the processed foods that are, for your audience, they can go look at the NOVA scale. Like, you should not eat anything that's a 3 or a 4 if you can avoid it. Real food always helps this problem. So being able to get that into your diet will help you. But so she just, as you start doing this, you will drop your inflammation score. The problem is it's going to stop at some point, because you still have a device that contributes to it. If in fact that's the driver, and whether it's a hip, knee, breast implant, all of them contribute to inflammation, because they're a foreign object in your body. So yes. None of it's without its consequences.
That's a good point, Doc. Good point.
Yep. For somebody that is maybe just like, do I have inflammation in my body? What are the other inflammatory markers? Most people are getting routine blood work just because, they'll get some of it done. But I think if the topic of inflammation is so important. So whether it's triggered and, driven by implants being present, I mean, everybody is inflamed to some degree. I just think that there are threats everywhere. What are the ones that you find to be the most reliable for blood markers? If somebody's like, hey, I did have labs drawn, my doctor said they were in range, they looked okay. Like, could you be like, oh no, there's something you may want to look a little bit deeper. I mean, I know you said CRP, but what other things? Because there are some other markers that, that probably aren't looked at as a driver of inflammation, but they could be linked to that, or a byproduct of an inflammatory state, or condition in the body.
Good question.
I think I will go the other route, and I've went away from the blood markers because they are not consistent. They're not elevated in everybody. So whether it's SED-rate, CRP, any of the interleukins, or any of the LP, any lipoproteins, like anything you're looking at, it doesn't, once again, this is the issue, right? It doesn't really give you the story. So then people are like, nothing's wrong. These are all fine. Those blood tests haven't changed since I was in med school, and I'm old. So I would basically say the things that are pushing this forward so that it's in everybody's consciousness now is like our understanding of the genome through the Genome Project. I'm older than basically Google. So that whole concept that's being driven now is like working backwards from genetics. That helps you as the practitioner if you understand it better. Like I said, and then instead of a blood test that just kind of is a script of the basics, like your the liver tests or the test for your kidneys or your blood count, like that stuff is not going to be off in a way that's meaningful unless you have something more difficult, going on. But that genetic test, that tox test, and like a GI map, those things help you. When I think of it, I know that doesn't sound great from an allopathically trained surgeon, but I just don't have a lot of use for blood tests outside of hormone evaluation. Obviously, I look for somebody who's anemic and basic things, but most of this doesn't really show up on a regular blood pattern.
Okay. That's good to know, because I think that that's kind of like the gold standard for most practitioners. They're just going to, if somebody comes in, something seems off. All right, we'll run a CMP, CBC. We'll see what shows up, and then most people are like, well, I still feel like garbage. And they're like, yeah, you look in range. You look fine. So, I think that just adds one more piece to the confusion because they think, well, I should feel fine. Is it
This is exactly why people don't go back to those doctors, and they'll go to an acupuncturist, a chiropractor, a holistic practitioner of some variety, some kind of functional or integrative provider, because they're not getting the answer to the question.
Yeah.
It's truly, it's like when you get, that's sometimes I find that it is frustrating to me when patients come in and they have quite a bit of like indicators, like their symptomatology, like you're saying, Doc, and then, they may not have all the indicators on their blood work, and they, in a sense, they try to rely on you to like try to find some deeper things and extra things, like to see why they're sick and such. And I know that can be a hard thing. It's hard for me. I've been trying to do all these years trying to find out if there was like different types of infections or different types of inflammatory rates within the body. And sometimes it's just hard. You have to keep like researching and doing your best from all the signs and symptoms I get, like just from the external, and trying to work with it.
Right.
Are you going to be down at down at Cellcore's meeting? Are you going to be down there in Texas in May? Are you going to be there?
Yeah, at ECO we'll be there. I couldn't go last year; it was conflicted with another meeting, but this one's in Dallas, so I'll make it to that one. I think
I'll be there too in this one. Yeah.
When they're doing this, like, we're just listening to everybody carefully. And I say this not to be rude about it, but if you listen long enough, the patient will tell you exactly what's wrong.
That's right. That's
tell
right.
you they lived in a moldy place or had something go off, or and mold is a really underappreciated environmental problem. It just is.
Yes. And I think that would be something too. Like, I'd love to read more of your information, Doc, and too. I need to, like, on there, because I know you've seen this, and but like when you talk about the mold and the biofilm, like I've had a couple of patients who had explant surgery and they found quite a bit of mold within like some of the ruptured breast implants, and they had pretty chronic issues with biofilms throughout their body, and just working on their biofilms seemed to really clean them out and help them with their symptomatology, because a lot of them were patients, their family and some of their relatives were saying like, you're just going crazy, like it's all in your head. And I was like, no, they you could tell that these individuals had parasites and biofilm and such. So it's a important work that you're doing. And I love like what you do on Instagram as well, and how much you show like what's going on in the body. Like you'll show the breast implants and you'll show you cutting the things out and seeing what happens and such with that. So that is something super important.
Well, fungus is like, I think, misrepresented. So mold is a fungus, and there's a lot of sensationalism about everything having mold in it. And when we look at PCR analysis of that, we don't see that. I've had 5 or 6 out of 2,000.
Wow.
So that's not the predominant, feature of this. And I don't really see that changing. The predominant feature is bacteria, because obviously, I think the mold we get exposed to either through food or the air gets sequestered in the liver and leads to its own, dysfunction, in that your liver's got to detoxify the majority of what you're faced with, and problems in the glucuronidation pathway, like we talked about earlier, will make that worse.
Yeah. I need to study that more too. That's a good point, Doc, about that pathway and that cycle.
The liver really is the MVP, I feel like, because it's such an important vital system and organ, detoxifying. And like I said, the assault on the body in terms of our exposures is huge, and it just keeps increasing because our world gets more toxic. But I love that you brought up the mindset piece a little bit ago, because I think that if in your mind you're convinced that you're always going to be sick, then you will only ever experience that outcome. So it is so important that we're addressing our emotional health and our mental health just as much as we're talking about the physical body. The physical body is taking signals from your mind. And if your mind isn't healthy, you don't have a holistic approach to your mental health, you are going to experience physical breakdown. There is no question about it. If you even your soul and your spirit of your life, like without getting on like my preaching, soapbox here, it's like that that is the core of who you are. The physical is just the flesh that you're wrapped in. If that is never addressed, if you're never putting effort into that, then you can't be surprised when the physical starts to break down. And so I think that having this holistic mindset about really addressing all the pieces, like you can't leave anything out, because it will create, like you said, you may get a little bit better, but then you're going to hit kind of a roadblock, a plateau at some level. And then you'll be frustrated thinking, well, what else do I need to bring in? What other products do I need to do? What other detox do I need to do? All the while, maybe you're living it with toxic thought patterns. Like maybe you have belief systems that haven't been addressed.
It's because everything is, ultimately going to revolve around how much discomfort there is. And I, for instance, had a patient of mine, Casey, who I had on my show recently. And I don't have a lot of guests, number one. It's mostly an educational thing I do just to help people better understand. Due to time constraints, it's hard for me just to do shows and things given my schedule. But I wanted to have her on because I've never had a patient be as positive before, during, after surgery. Like, it's just the most positive person. And I brought her on not to discuss, explanting and all these different things, but more her mindset. Like, why was she so specific and set up to function that way? Like, some people, for instance, they're very concerned on how much, I slept the night before or how much I'm doing something. So I've operated since 1996. Like, I will execute everything that needs to be executed in the operating room. What I want you to do, either through meditation, qigong, telling yourself, relaxing yourself, like get into the right frame of mind before surgery. And we do things to help with, calming down the nervous system. But if you can do that, how you go into surgery will lead to how you come out of surgery. And then everything on top of that, I tell folks, like, they're like, oh, I'm not doing as well as Susie Smith on the internet. Well, I don't give a shit about that. All you have to do is, in your own mindset, be positive and make progress. Slow progress is better than no progress, and progress is still progress. It doesn't really matter if you look at everybody's different recovery timelines. Yeah, I'm working really hard to take outliers out of it. So I'm trying to push everything into the middle of a bell curve so everybody's really recovering at the same time, knowing that I'm never really going to be able to get that done because everybody's so different from a biologic standpoint and a psychological standpoint, and their social settings very different. So if everybody listening follows along, like, I will do my best to micromanage the biology, but you got to work on your mindset. And we've basically started this collaboration with Amanda Savage Brown to help with that, with therapy sessions for my patients specifically. And then we have health coaching and detox practitioners to help more with social support. But that's 2/3 of an equation, where I'm just really, as a surgeon, trying to help with this and control and micromanage this 1/3 to the best of our ability. But pain is a subject that involves all of those. It's not just what I'm doing. So I had Casey on to talk about it, and her spouse was super supportive, the nicest guy. I feel like I have to have a show with just spouses at some point, because it's a big deal for their spouse. And the more supportive they are, I feel, obviously it's an easier overall process standpoint. And I think the spouses, that's a hard one for them. They don't know quite what to do. And, there are just, some of them are here just, in the office, super supportive. I get those guys massages and stuff. Any caregivers who come, I usually get them a massage or a facial or whatever it is that, we can do, because they're playing a very pivotal role in the process. And from the jump, if they're there and super supportive, it definitely is easier for our patients.
Wow. I mean, if that doesn't just preach right there, I mean, what you are around, you absorb. Like, you will take on the energy, you will take on the attitude to some degree of the people that are in your closest circle. And that plays a massive role when we're talking about the potential of your healing. So I think that that's super significant that you just addressed that. And you're even placing, I mean, it just says, it really exposes how important it is by the intentional effort you're putting towards taking care of the caregiver. Like, that's huge to me, because you realize, hey, when I release this person from me doing my job in the operating room, the real work then starts. Like, the real healing can start taking place. But if their home life isn't set up for healing, I mean, the body's going to respond. Like, you will see a dramatic difference. Like you said, like, I would love to know, like, somebody that has that kind of perspective and joy, like, you're not getting up every day and your circumstances around you are just telling you be joyful. There are plenty of things around all of us that will communicate a different message. So you have to be intentional about those thoughts. You have to take those thoughts captive. You have to realize that it is a choice every single moment of every day, how you're going to react in those different circumstances, because the world's broken and there is a lot of heartache and hardship around us. So I think that it really says something when you see somebody that has that positive perspective, and then you were able to even see, wow, look at the person that's closest to her. That person also shares that. If she had a person that was like, oh man, I wish you weren't doing this, you're probably not going to get better, she probably would have been robbed of that joy, like, to at least a certain degree. So I just think that that is so important. If you are chronically sick or ill, it doesn't matter if you have implants or not. Take inventory of your household, take inventory of the people that are in your closest circle. Because if there is some kind of toxicity that is stealing your potential to heal because your inner peace and your joy, like, there's no room for it, right? If somebody's stealing that from you, or in some way creating an environment that breeds negativity, like, that is going to influence the way you see yourself. And you won't even feel worthy enough to heal. You'll just feel like this is as good as it's going to get. So I love that you said that. I've never heard a doctor kind of bring that up and really even, go out of their way to put effort into that. So any final thoughts for our listeners that, really are interested in looking at the long term for their healing? I know you have so many different resources, and you've got educational resources for people to be able to look at, their own health kind of from the perspective of your different supports and packages and things like that for recovery if they're going through explant. But any final thoughts for us as we kind of take this, put a bow on this conversation around implants, explants, toxins, kind of all of the different terrain that we've covered?
Well, I think just like your show is imparting the best information, I try to give out information with as much evidence behind as possible, because I've spent so much time working on this problem. So you can check out our shows and just see if this is a problem that makes sense to you, that resonates with you. So Breast Implant Illness with Dr. Robert Whitfield on Spotify and Apple. Same on YouTube. And through supplementation, you can really help yourself. So the inflammation support bundle we have, that's basically liposomal or liquid, will help you, especially if you're experiencing gut problems. So that's a way to help yourself starting today. And then cut out things in your life that, one, are driving problems for you, but from your diet and your fluid quality, your air quality, things that you can adjust now will help you. And then try to the best of your ability you got to work on your mindset. And I have a couple people I'm thinking of that are challenged by this in my practice currently. But it doesn't matter how, effective any of the practitioners you are working with if you don't help them by working on that mindset for them.
Yeah. That is so, so good. If you don't have, like, if you really do feel like you've hit that barrier, and I know there's a number of you out there that maybe feel that, and you're like, I'm tired of spending money. I'm tired of having to, spend all this time searching and digging for information. And I feel like it's, only gets me a little bit better. I would really look into the mentorship of somebody that can almost like be an outside person that can evaluate those big pieces of your health puzzle. They can look at your spiritual, your mental health, your emotional health, because sometimes you're so close up to the things in your life that you just don't have the same vantage point. Like, you cannot see what other people may be able to see too. And so if you can't get a support system around you that can evaluate all of those, I think that's so, so important, and it can't be overlooked. Like, I know that for me, like, blind spots, everybody's got them. And those are pieces that, like, sometimes you just need people that are deep in your world with you, but that have this ability to share wisdom, right? And that's really valuable. You don't need a million different people and a million voices. I think we have plenty of those in the world, but just really start to look at what is it that is contributing to my overall physical expression, and look at all the different potential areas. I love, Dr. Rob, that you do that as a part of your expertise in your world with explanting and helping women. I mean, I think that it's so commendable that you don't leave any of those pieces unaddressed. So if you are listening and you're someone that has implants, you've been sick for a long time, maybe you just have some symptoms that seem unexplained and you just don't have an answer for them, he's a great resource. And definitely check out his website. You've got the Sharp protocol and resources as far as the supplement packages. Like you said, supplements can go a really long way, and that's something you could do immediately. Some of the lab testing, the GI map, the genetics, all of those things are great. He has all of those resources laid out for you. So working with a functional med or with a practitioner that has functional med docs in their in-house is of tremendous value. So go check those out. We're going to make sure that they're all linked here in the show notes. I know you said you have a book coming out, so you'll have to keep us updated on the launch date for that. Maybe we'll time that around when our podcast releases here. But guys, I hope that you enjoyed this episode. Dr. Rob, I'm so grateful that you shared time with us today. I know you're a busy surgeon. You've got a lot of people to see and a lot of things to do, but we're really grateful for your wisdom, your expertise, and for you sharing your time with us today.
Thank you for having me on. I really appreciate it.
All right, guys, if you loved this episode, make sure you share it. Connect with us at the Health Institute. You can DM us personally. Dr. Motley, it was great to have you with us today as well. And we will see you guys on the next episode.